My name is Douglas Gibson and I specialize in cardiac electrophysiology. I've been practicing medicine for 10 to 15 years, 10 of which has been spent here at Scripps Clinic. I practice primarily here at Scripps Green Hospital. I also practice at the Prebys Cardiovascular Institute. I'm spending more and more of my time over there at Prebys. I also have several outreach clinics, one of which is, the most prominent of which is up in Temecula. I chose the field of cardiac electrophysiology because it's number one, it's a very exciting field, and also it's a field where I have a lot to offer patients. We can really do a lot of very exciting things to actually fix people. You know, a lot of medicine seems to be managing chronic conditions, but in the field of cardiac electrophysiology, we have some safe, minimally invasive tools that we can use to really provide a very significant difference in patients' lives. We were fortunate enough to pioneer several procedures here, and so in particular, left atrial appendage occlusion procedure is something that we were involved in the research for here at Scripps. Up until this point in history, patients, in order to be protected against stroke when they suffer from atrial fibrillation, would have to take a blood thinner. Blood thinners are a great life-saving therapy, but they do put the patients at risk for bleeding. We now have a revolutionary technology available in the form of the WATCHMAN procedure, which is a minimally invasive procedure that we use to plug the left atrial appendage. So this is an example of the WATCHMAN device. The device is inserted through this small tube here, which is called a catheter. We basically thread this catheter through a small puncture in the groin up into the heart, and then this device here is the actual WATCHMAN device. It's like a tiny parachute, if you will, but the device is used to occlude the left atrial appendage. What happens is we place the device in the heart, and then we effectively deliver just this piece here. This is the WATCHMAN, and this stays behind inside the patient's heart and effectively seals off the section of the heart where the blood clots form. One of the things that troubles a lot of patients with heart rhythm disorders is it produces symptoms. It causes them to get lightheaded and dizzy and short of breath. The majority of my practice involves around catheter ablation, which is a minimally invasive procedure where we place small catheters through venous puncture sites. We track those catheters up to the heart, and what we do is we heat up and destroy the abnormal heart muscle that's causing the arrhythmias. So what we do is we effectively get rid of little bits of abnormal heart muscle that are causing problems, and that allows patients to be taken off of drugs and live a nice normal life without having to be troubled with the symptoms of arrhythmias. You know, these procedures that we do are minimally invasive. That you don't have to take 6 months out of your life to recover from them. It's typically just a small puncture in the groin, an overnight hospital stay, about a week or so of recovery, but then patients can largely get back to whatever it is that they do very quickly thereafter. My philosophy of care is one-on-one attention with the patient. I'd like to get to know them a little bit, get to know what's troubling them, and hopefully take care of the exact issue that's causing them the most concern in their life. For my practice, most of the time that means patients are having symptomatic arrhythmias. Those arrhythmias are stopping them from doing what they want to do. But a lot of times it's just patients are concerned about dying, and just to be able to provide them with the relief that this is not a life-threatening serious arrhythmia for you, just to solve problems. I got in this business to help solve problems, and fortunately I'm in a situation where that's what I get to do most of my day.